Hello and welcome to assessment of the abdomen. My name is Stella Maris and this is my clinical demonstration of how to assess the abdomen. Today my patient is
Ruth.
Thank you, Ruth. And for this particular clinical component, I have my stethoscope, a marker, and a centimeter ruler for measuring. Okay, Ruth, what brings you to the clinic today?
Yesterday I started having abdominal pain around my knees.
Oh, okay. And what caused the pain, or did you notice how it started?
I just started.
Okay. And how bad is the pain on a scale of 1 to 10? 10 being the highest.
About a 3.
About a 3?
Mm-hmm.
Okay. And is there something that you do that makes the pain worse?
No, but when I lay down it feels better.
When you lay down, it feels better. Okay. When you move around or when you cough, does it make it worse at that time?
Yes.
Okay. Okay. Well, what we're going to do is to go ahead and assess your abdomen, see if we can find something that may give us an idea of what may be going on. I'm going to be assessing, percussing, palpating your abdomen. So at this point, I would like to see if you need to use the restroom to empty your bladder.
I already done that.
You already done that? Okay, great. And how about the room temperature? Is it comfortable? Cool? Okay, great. We like to keep it a little bit warm because I'll be exposing your stomach so that you won't pain off when assessing your abdomen, okay? So we're going to start the assessment of the abdomen at this point after I have heard a little bit of history from my patient. Okay, Ruth, what I'm going to do is to do a general assessment. Kindly just go ahead and lower this to expose your abdomen. Looking at my patient, she appears comfortable. Respirations are even, unlabored. Respiration is probably about rated at 18. There's no use of accessory muscles for respiration. Okay, Ruth, if I can have you look up. Okay, there's no evidence of jaundice, no sclera in the eyes. And if I can have you look to your left, all the way to the left. Okay. Okay, and the jugular vein is not distended at this time. If I can get you to open your mouth, please. Say ah, ah. Tongue out. Okay, back in. And if you can put your tongue up to the roof of your mouth, ah, okay, good. Okay. There's no thrush, no evidence of cavities in the oral area. Okay, Ruth, what I'm going to do is to examine your hands. Skin color is even, no cyanosis. Color looks great, even skin tone. I'm just going to pinch a little bit over your skin. Okay, I just checked for nutrition by checking the skin turgor. There's no tenting, evidence of good nutrition. Okay, Ruth, if I can have you extend your arms this way and tilt it back. Great, thank you. No flapping, no tremors. No cyanosis, no clubbing evidence at this time. Okay, what I'm going to do now is to take a look at your abdomen. You can go ahead and relax for me. looking at the abdomen, it is flat and symmetric bilaterally. I see a little bit of striations and a couple of marks. Do you know how you got these marks here?
They're chicken pox scars.
Okay, so you've had chicken pox from birth? Okay. Okay. And the umbilicus is midline, inverted for most part. No surgical incisions. No bulges, no mass that is evident at this time. Okay, I'm going to check as well from this angle. Okay, Ruth, if I can have you cough for me. Still no visible changes evident at this time from the stated points before. Okay, what I'm going to do now is to listen to your abdomen for bowel sounds. Be sure bowel sounds are present. I'm also going to listen for circulatory sounds over your aorta, your iliac, and your femoral arteries, as well as see if there's any peritoneal rubs, okay? Okay, bowel sounds are present and they are actually hyperactive. I'm going to listen to your I just listened to my patient's iliac, femoral arteries, and over the aorta right beneath the thoracic cage. There's no peritoneal rubs, there's no venous hum, no bro is hard at this time. Okay, the next thing I'm going to do is to percuss your abdomen. And basically, I'm just going to gently tap over your abdomen. Just to hear the sound, be sure we hear a tympanic sound pretty much, or what sound we're going to hear over your abdomen, okay? Okay. My patient has tympanic sounds pretty much on all 4 quadrants. Okay, next thing I'm going to do is to palpate your stomach. Because you did complain of pain, I'm going to first of all do a light palpation on you. in all 4 quadrants as well, okay? And tell me when you feel any pain or any discomfort. Any pain? Okay, I'm also going to do a deep palpation, see if you feel any pain at this time. Okay. Okay. My patient did have slight pain to lower right quadrant, which could be an indication that my patient may possibly have appendicitis, but we will continue the examination at this point to help us determine that. Okay, Ruth, I'm also going to palpate the edge of your liver. The liver is non-palpable, but what I'm going to do is to go ahead and palpate the edge. Be sure it is seated where it should be, that it is not inflamed, okay? I want you to take a deep breath and hold for me. Okay, breathe out. Okay, great. Okay, the edge of the liver is firm, it's palpable. Okay, I'm also going to percuss one more time. You can relax for me. Okay. I'm just going to percuss one more time to measure the borders for the liver. So I'm going to go from my area of resonance have a dull sound right here. Okay, continue percussing. Just going to measure real quick. And it does measure right about 6.5 centimeters, which is right within the normal range. Okay, next thing I'm going to do is to assess for what we call rebound tenderness, because from the examination we've been doing so far, there's a possibility that you may have appendicitis. So we're going to do a range of motion that will further determine that diagnosis for us, okay? Now I'm going to dip my hand in your stomach and tell me where you feel the pain, if you feel the pain. Okay.
Yes.
Okay. Okay, next thing I'm going to do is to do the psoriasis sign, and basically with this test it's going to determine if there's further pain in the iliac area. Okay, I want you to raise your right leg against resistance. I'm going to put resistance against your leg, okay? Okay, you can raise it up. Let it down. Any pain? Slightly? Okay. And I'm also going to do one more test, the obturator test. And basically what I'm going to do is lift and flex your knee and rotate internally at the hip. Any pain?
Yes.
Okay. I'm sorry. The last thing I'm going to do is have you raise up a little bit. I'll help you up. Since my patient has been sensitive on this examination, I'm also going to go ahead and assess her for severe tenderness. I'm going to percuss your back and let me know if you feel any pain. And I'm going to percuss right around the 9th and 10th intercostal area. Any pain?
No.
Any pain? Okay. Lay back down. I'm also going to check on your spleen. Okay. Just relax for me. Okay. Any pain? Okay. Okay, at this time I'm going to recommend my patient for further diagnosis based on the assessment. She was positive on the psoriasis sign, positive on the obturator sign, also on the rebound tenderness. She was slightly sensitive as well. So this could be an indication that she may be having appendicitis. And at this time, we'll go ahead and recommend further testing for my patient. Thank you.